And we're back. You're listening to the WCEG network on WCEGTalkRadio.com, the worldwide community empowerment group. Like us on Facebook, and we are live streaming on Facebook, so you can watch us there. Follow us on Twitter, on Instagram. You can Skype in and join in on our conversation. We'd like to hear any questions from you, any experiences you've had relative to our show topic today, which is stroke and lupus, and the connection between the two. We are also live streaming on YouTube, live TV. That's where we are. I'm Myrna Taylor Ransom. I'm your host for Your Good, on the show For Your Good. And joining me today, we have our medical experts today. We have Doctors Aaron Pettyjohn and Charles So. They're both from the Morehouse School of Medicine. And we have also our regular traveling nurse, Pamela Davis. Thank you all so much for joining us.
Thank you for having us.
We've been having a pretty good discussion on stroke and lupus, and then the connection between the two. So we were beginning to discuss the connection between stroke and lupus. And there is a definite connection that people with lupus are more likely to have a stroke. And we were talking about some of the causes of lupus. We talked about different things that enter the body that affect your immune system. But we did not discuss sunlight. And I understand that sunlight, as an environmental hazard, can trigger lupus.
Yes, more specifically the rash. So especially the areas where where you're exposed to the sun, especially on the face and those areas there, is where you can see that rash that we were speaking about. And that all kind of goes in with, there's radiation from the sun. It goes, and not only with something like lupus, but it affects the way our DNA is can break down and be reformed in new kinds of cells. So you can get damage from this radiation, and in that area where there's this damage, your immune system is supposed to go and help to fix damaged areas. So when you go out and get, go out in the sun, and for people that get sunburned, when their skin gets sunburned, our immune system is supposed to go and try to fix some of the damage made by the sun. And as we know, with the lupus, it affects our immune system. Our immune system is in overdrive. And so when it goes to try to correct this damage that could be coming from the sun, you can get that rash on the face in that butterfly shape. So that's what the connection, or how those two can be connected as well.
Okay, now let's go to this big word here, histopathologic and the radiological studies that have been done about lupus. What does that mean?
So the term histologic or histology, that's the study of like cells. And so when we go and try to find different diseases, we can take some parts of the body or blood, different things of that sort, and we can look at that under the microscope. And so with lupus, we can kind of look at different blood cells under the microscope, or just not the blood cells, but different like
the skin rash.
Skin rash, you can look at that under the microscope also. And so when you're looking at that under the microscope for someone who has lupus and the areas that are affected, what you will see is a greater number of our immune cells. We call them inflammatory cells, or cells that come along when there's damage. You can see greater numbers of those in the affected areas. And so that's what we can use to kind of, or what we've used in the past to try to get an idea or an understanding of what lupus was or what it is.
So these studies can show brain abnormalities.
Anywhere where lupus is affecting the body, you can expect to see some of those similar findings under the microscope. Those increased numbers of white blood cells, those blood cells responsible or part of our immune system. And then any damage that those cells have done in the brain, it's possible to see that as a result as well. And in the past, people, they don't take these samples from people who are currently still living. These are people who may have already passed, and they're trying to figure out, well, what's going on with this person, so they can do studies on these people's brains that have passed to try to get a look at what's been going on.
And then once, if a stroke occurs, then they'll see more detailed what actually happened.
In this case, if this person happened to have lupus and they've also happened to have had a stroke, and people have agreed to allow for an autopsy, they could take a look at the brain to see what could be happening in there. And not only that, these our immune system not only attacking just the brain cells, but again the blood vessel cells that are part of the blood vessels in the brain. Damage to the blood vessels cause that inflammation, which can lead to some of those things we spoke about with stroke. When there's damage to the blood vessels, there can be plaques that form, or there could be blood clots that kind of form around this inflammation or around the damage to the blood vessels.
How can a person tell if they are maybe experiencing a lupus attack or the onset of lupus?
Well, I think the one thing is if they've gone in and they've been tested for lupus and they've been diagnosed with lupus would be the first thing to know. You could have many of those symptoms we're speaking about that doesn't necessarily, go only with lupus, the joint aches, the rash, things of that sort. And so if a person has already been diagnosed with lupus, they can have an idea. Okay, well, when I went in, I was having some of these symptoms. My joints were aching. I had this rash on my face, fevers, some of those things. And now I'm feeling these symptoms again, especially I know something's happened in my life where I've been stressed more lately, or sometimes a person may not even know their source of stress, but they may have this flare, like going out in the sun for too long. They can have an idea that, oh, well, I think this may be my lupus that could be causing this. And there could be even new symptoms they may not even realize that could be linked to the lupus. So I think it's important for the person who's been diagnosed already just to try to pay attention to the body. Person, they know their bodies, so they know when something is off. And so when they know something is off, it's important to be checked out, at least by the primary care.
I'm not understanding why it occurs more in African Americans than Caucasians who do a lot of tanning in the sun.
It's not. It's not the exposure to the sun that gives you lupus. If you have lupus, you're more sensitive to the light.
Okay.
That's the. I don't want to say that sun exposure can trigger my lupus, which is true, but that's for people that have lupus. If you
have it already.
Yes. If you don't have lupus, please get out, be under the sun, get your vitamin D, and but you always have to protect yourself.
Sunscreens? Yes, no.
It all depends. I will not say everybody should have.
Our bodies are too complicated, right?
One thing that you don't have to be exposed to the sun for hours and hours and hours, but we need to have some sun. And if you have long exposure, just wear some long sleeves, wear a hat, keep yourself hydrated. Yeah,
So that would help.
Yes, but please be outside, play outside. But you just have what we call sensitivity to the sun when you have lupus.
Okay.
But it's not being outside that make you have
Triggers
lupus.
it. Okay.
Yes.
Okay. Now I understand. That's better.
Yeah.
At least I thought the sun was always good for you.
Yeah, it's good for you.
Yeah, it's good for you.
Okay. But if you have lupus,
Protect yourself.
protect yourself
Put some
because it can
sunscreen.
trigger a lupus attack.
Wear a hat. Wear long sleeves.
The rash, if nothing else, it could trigger the rash. It may not
Why a
trigger
butterfly?
anything else. That's just
That's
happens.
how it does?
Yeah,
That's
that's just
how-
happened.
That's kind of strange, huh? the shape of a rash being a butterfly.
I think also just the natural shape of the face. The sun typically
The
comes
way it
down
hits you.
from the top, and it'll kind of hit like maybe like the bridge of the nose first, and like the cheeks. And some people may have a little fold here, and the sun may kind of not get as exposed to that area.
As if you had on a pair of shades or something.
Yeah, yeah.
I'm looking at his, Dr. So has a diagram of this butterfly shaped rash.
Can you hold up your
Look at that.
laptop to them?
So it's almost like, and I've actually seen that on some people. So it's almost, it's like a butterfly or a bat. I would go there, huh? Like a Batman mask or something.
Yes.
Look at that.
Okay. Can you see that over there?
Now,
Can the
it's-
camera pick that up?
It's going to be difficult.
There he is. Okay.
Wow.
Wow. Okay.
That's what a butterfly rash look like.
Wow.
It's
It
a
look
butterfly
like-
rash. It's a bat. This is more like a bat to me. But, okay. I hate to put that rash on a butterfly. It's so innocent and beautiful. How about bat? Let's just put it on bat. But, because I don't like those. But, yeah, that's what that rash looks like. Thank you, Dr. So, for that diagram. That kind of puts it in perspective. At least it lets us know if you see that on your face, call a doctor, get to the doctor, because that could be the first sign of lupus. Okay, let's move on to discuss the connection between stroke and lupus.
I
I understand that people who have lupus have an accelerated rate of coming down or enduring a stroke as well.
So, like we were speaking about earlier about the increase in inflammation. So, with lupus, our immune system is going overboard, and so it may start attacking some of our cells. When that happens, there's damage to our cells, and so inflammation can occur. And so some of this can occur in almost all of the body. And so this can occur in the blood vessels in the brain and the brain itself. And so in there, we were speaking about how the inflammation there, when people have inflammation in our body, they're at increased risk of stroke. In blood vessels themselves, it can cause plaques to form. It can cause clots to form. And with those, it can, if there's a plaque, it decreases blood flow to the brain, or it can even cause the blood vessel to burst open. If there's a clot, it can block the blood vessel, and it can lead to decreased blood flow to certain areas of the brain. And so with those two different mechanisms, or those two different ways, could lead to stroke or increase the risk of stroke in someone who does have lupus.
Because the only thing you have to remember is the inflammation. And that inflammation, it's not inflammation. In lupus, it's an inflammatory disease. It's inflammation in your joints because you're making antibodies against your own body. So you start attacking your joints. So that's creating inflammation in your joints. But anytime you have inflammation in your joint, also remember it's not the inflammation on your joint, it's inflammation in your entire body. It's inflammation in your blood vessels at the same time. So inflammation in your blood vessel increase the addition of platelets. And when they start sticking together, you have those can be responsible of not only stroke but heart attack at the same time. So it's an increased risk. If you have an inflammatory disease, it can be lupus, it can be rheumatoid arthritis, it can be other inflammatory diseases, but you have an increased risk of heart attack and you have an increased risk of stroke.
Why do
So, yes. So
Go ahead.
what is important in to decrease, because what we're trying to do is to decrease your risk of stroke. So to decrease your risk of stroke, that's how the treatment is important, because the treatment for the inflammatory disease is to decrease the inflammation. And how they decrease the inflammation by giving some medication. They can be decreased. Most of them now, you have immunosuppressant medication that decrease your immunity and decrease these antibodies from attacking your body, and that's decrease the inflammation. You have medication mostly for lupus, what we call Plaquenil. It's a medication against malaria that also decrease the inflammation and decrease the symptoms of lupus. You have methotrexate also that can be given sometime that decrease.
What was that?
It's
It's a medication?
yes, it's a
Okay,
medication
all right.
for. We give it to decrease the inflammation also. Those medication really help decrease the inflammation and decrease your risk of stroke. There is no. You still, even if you decrease those, if by taking those medication, you still have that inflammatory aspect in your life, in your blood vessel, that is always more important than people that have no lupus. But still, it decreases the risk. And that's all we're trying to do is decrease the risk.
Is that why lupus patients have oxygen tanks sometimes? Well, why is that then?
It depends where like I said earlier, it depends. They don't have necessarily oxygen tank, but it depends where you have the maximum lesion. If your lupus is attacking your lungs, you're probably gonna have more problem breathing. If you attack your kidney, you're gonna have chronic kidney disease, and you can end up having dialysis. If you have lupus that really attack your joints, you can have problem walking. Some use a cane. It all depends how your disease manifests. Because remember, lupus, it's so many symptoms between those joints, fever, hair loss, fatigue. I mean, it's too many symptoms. They all depend what is more important as symptoms at this time.
But lupus is treatable.
No, there is no treatment for lupus.
No treatment.
No, it's not curable.
It's not
It's
curable.
not curable, but
Yes.
there is treatment.
Yes.
There is treatment, but it's not curable. If you have lupus, you have lupus, period. So it's a lifelong treatment. That's why you need to have a rheumatologist that follow you on a regular basis with regular appointment, but it's not curable. The treatment is to decrease your symptoms and for you to have kind of a normal life as possible, but it's not curable.
Yeah, that's the negative side of it, right?
I will call it not the negative side, because anytime you say negative side, you become depressed. I want people to live with lupus, to live with their disease,
But there is
and
hope.
make the best out of it.
There is hope.
Yes.
You can live.
If
you
you
can
have-
live a long life with lupus.
I want to say you cannot live a long life with lupus, because all lupus are not the same. They're all different.
Are there different degrees?
Yes, there is different
Really?
degrees of lupus. Some have very, very mild lupus. Other people have very severe lupus.
Where
So
they deteriorate.
yes,
They
it's not everybody have the same lupus.
What is loud?
Mild is really your symptoms are not that important. They're not preventing you from walking, from living a normal life. Those symptoms are controlled with medication, and you can ride your bike, as we say earlier. You can go swimming. You can.
We had a lot of resistance to that bike riding. Nobody wanted to ride a bike. It's like, I did that as a child. I have no desire to do it now. How
But-
about an electric scooter?
It's very dangerous by the way to ride an electric scooter because
Not the same effect.
no, and they have no good effect on your body. But like I said earlier, lupus it depends how, but you have to live with it, and you have to when you have a disease, you have to learn how to live with your disease, and know that it's part of it, and just live with it.
And there is hope.
There's
Yes.
always hope.
Yes.
There's always hope.
As long as you breathe, there is always hope.
As long as there is life, there is hope.
Yes.
So you have to keep
Yeah.
fighting.
Keep fighting. Absolutely.
Keep fighting. And I guess that's the best that we can do once we acknowledge or get diagnosed with a life-threatening disease.
Yeah.
Is keep hope alive and
Yes.
get your treatment,
Yes,
take your
have a-
medicines.
Yes, have a healthy life. When you have lupus, don't smoke, don't drink alcohol.
Oh,
Okay.
you know, I do know someone with lupus, and they do drink.
Okay, don't drink alcohol. No, don't drink alcohol.
Don't drink alcohol. And because that compromises your immune system.
Yeah.
So you defeat the whole purpose
Yeah,
if you're
you-
going to
you
have this
eat-
disease and then you still
Eat your strawberries.
Imbibe.
Eat your berries. Eat your nuts. Drink your water. Exercise. And
Protein and your antioxidants.
yes,
I don't know really how we got away from those values.
we can. We can.
You know, but we have.
It was the commercials.
Okay, let's blame it on TV. No, not a good one.
The billboards when you're on the highway.
Yeah.
It had McDonald's.
Oh yeah, when you see signs that say "Stop here for food."
Okay.
Very next
Which
fast
is
food.
fine. Which is fine. Go to McDonald's. But like I said, they have good option also in McDonald's. Get the salad with the grilled chicken. Stay away from the if you take the dressing, get a fat-free dressing to cut down the calories. So there's
They have
always good
fat-free
options.
dressing?
Yeah.
Yes, they do have.
Yes, they do have.
There is fat-free dressing. Now that you know, all you have to
I
do
don't
is
eat
order.
salad. I don't eat
You don't eat
salad.
salad.
No.
Yeah.
Now she doesn't eat salad. What?
I don't eat seafood. We've been there. But we'll stick with the nuts and the berries.
Yeah.
Nuts and berries. Okay.
Yes.
Wow.
So
And plenty of water.
yes, any
Yes.
chronic disease, you have to know how to live with it. If you have hypertension, you need to know how to live with hypertension. If you have diabetes, you need to know how to live with diabetes. If you have cancer, you know, breast cancer, you know how to fight breast cancer. I mean, it's just exercise and healthy diet is probably one of the best tool that we have. Not only the only tool, but is one of the best tool against breast cancer.
And what about alkaline water?
I don't have all the studies about alkaline water. I think water has been made by two hydrogen and
One oxygen.
one molecule of oxygen. And some water has some minerals because they go on top of the rocks. But that's what we call water. I don't know alkaline water, acid water, all this type of vitamin water.
Well, what I heard was no disease can live in an alkaline environment.
So I've only read like one article on alkaline water, and you know you always have to be careful about what sources that you're looking at. So I'm still up in the air about the validity of this article, but from when I was reading, it was speaking about how because naturally our stomachs have acid in it.
Right.
Okay, so
And an
alkaline.
increased amount of acid in the mornings from overnight.
Yeah. So alkaline water, what that does, it's the opposite of acid. And so when you drink it, it's going to go into your stomach and it's just going to, it's like equal out. So there are chemical reactions that happen where the acid and the alkaline come together, and what ends up making is water and a form of salt. And so after that happens, so you essentially what goes into your intestines is going to be water and salt. Is there going to be much of this alkaline source? Is that as much of that you actually going to get into the bloodstream? That I'm not sure. And even so, if that does happen, what are the effects of that? That I'm not sure. So I'm not entirely
And I don't think
sure.
right now too many people are sure about it.
So what it does for your health, not entirely too sure. I'm planning on just continue to drink the water that I used to drink. I'm not saying go out there and drink your alkaline water because it does this, this, and this. But I'm also not saying to not go out there and drink alkaline water because then again, who knows what it does? If it does any benefit, does it do any harm?
I think it's worth a try. That's my personal feeling about it. I buy alkaline water because I believe that I'm really leaning towards the disease can live in an alkaline environment. I mean, they have studies that have shown that. So
The one thing that is important is to again to go back to the basics, and the basics are eat your vegetables and eat your fruit and drink your water.
And you're nuts. Right.
Eat your nuts.
whether it's alkaline water or just purified water or
I mean,
tap water.
You know where you're tapping.
you have to know where's your tap water is coming also, because there is some, we know if what happened in Flint, Michigan, sometimes the water is not that safe, but most filter your water if you can. But water,
Period is a good source.
it should be safe. I mean, we want to drink a safe water, and most water, most of the time, is safe.
And to go back to the alkaline water, so naturally our blood has a certain kind of amount of acid versus base. And so we call it, if people are familiar, the pH of blood or pH of different things. So alkaline water is not a lot of acid. And then stuff like acid has a lot of acid. So our bodies naturally keep our acid levels versus our base levels under control. So even if you do introduce something like alkaline water to your body, if you were to drink enough of that to try to change that in your body, our bodies are going to naturally try to get it back to where it's supposed to be. Mm-hmm. And so people who come in who have too much acid in their blood, our bodies do something. We start breathing very fast because one of the forms of acid in our blood is carbon dioxide. And so when we start breathing really fast, we start giving off a lot of our carbon dioxide to try to get our acid levels in our blood under control. And similarly, if there's too much, if there's not enough acid in the body, our body does things to try to get it back to where it's supposed to be. And so in that sense, I'm not sure how much alkaline water you would have to drink to try to make your blood too alkaline.
You have to drown your body in alkaline water.
And by that time, I think you would have too much water. So there's also such thing as too much water as well. It can change
Especially if you have congestive heart failure.
Yes. But naturally, if you listen to your body, your body will naturally tell you, okay, you drank enough water. Let's try not to drink too much more water.
And it's almost like a drowning feeling. You kind of, when you have too much water in your body, you can tell the difference. Well, I can anyway.
If you drink too much water, you wouldn't know the difference. Your electrolytes will, You know.
If you drink too much water, you start going to the restroom. And
Well, that's the first.
It's like a drowning almost. I mean, you feel like it. A full feeling. It's a real fullness.
One thing that happened, and since we talked earlier about heat stroke, people that exercise in the under the sun, under the heat, they sweat and they lose salt because your sweat is very salty if you taste your sweat. And what they do, what is dangerous to do, is to replace it with just plain water, because that water, your salt in your body start going down, and when you start going down, you start having some cramp, and you can go further to some type of coma. So that's why you have, they call it Gatorade, or this water that have some salt and a little bit sugar, but those
Salt, a little bit of sugar. Yeah.
they if you really dehydrate it and working under the sun, so just plain water sometimes might not do it. You need water that have a little bit salt and a little bit sugar. But just to say, your body is always, when we go back to alkaline water, or your body is always trying to get some
The
balance.
acid balance back.
Yeah,
Acidic
acid and
balance.
base, because you have acid on one side, base on the other side. So it's trying to make the balance.
What about carbonated water?
Drink water.
As in your Perrier and your San Pellegrino? Those are not good?
I think those are for people that want the taste.
Yeah. I like those.
Which is fine, which is okay.
Okay.
But the just your plain water should be enough.
But it's okay to drink those.
Let me say something too, which is have
I'm
also.
trying to get him to validate me drinking.
No,
Yeah.
I'm looking at people's finances.
Oh, yeah.
We spend a lot of money buying water.
Yeah.
Which is totally,
And it's more expensive, too.
That water is very expensive. We don't pay attention to it, but it's a very expensive water. And second, is doing really bad thing to nature, because it's those plastic that cannot be destroyed, that you find in the ocean, and
Can't
now
break 'em
fish
down.
and whale, all these things are eating this plastic and dying. So we need to probably stop buying this water in bottle, plastic bottle.
Well, you can break down glass now. You can. That will break down, right?
It's gonna cost more. It's gonna cost more money again.
Okay.
But the cost of Fulton County water is probably a few cents, not even a cent, to have a glass of water. But
Yes,
if you want
regular water is more.
buy this bottle of water, might be 50 cents, sometime $1 if you buy it
Right,
somewhere
right.
else. And that's
Whereas Perrier
accumulate-
will be $2.50 a
Yeah,
bottle, or
2.50
San
a
Pellegrino
bottle.
$2.89.
Yes. And
It's expensive.
for my friends, I will suggest that you take that money and save it for your retirement.
Buy more vegetables and fruits.
And use that money to buy fruit and vegetables, because fruit and vegetables sometimes are not that cheap. Yeah,
Yeah, and especially if vegetables are really expensive nowadays. And if you notice all of the organic places where you can buy food now, it's just astronomical.
yes. So spend that money into
To eat healthy is very expensive.
Yeah.
Now that's got to tell us something.
Yes, so spend your money into buying healthy food, then buying water, whatever the type of water it is.
Oh, he just burst my bubble, didn't he? Okay, Dr. So. Okay, we're coming to the end of the show, but we want to recap some of the important issues that we've covered for today. And I guess we should go back to the beginning of the show where we started out with stroke and recognizing our risk factors.
Hypertension.
Diabetes, high cholesterol. So making sure we keep track of all those things and to work on those things. Plenty of exercise,
Right.
plenty of water, and limiting all the bad things in your diet. high cholesterol foods, high fat foods, all of those things. Recognizing symptoms of the stroke. Remember the abbreviation FAST.
Fast.
F for the face drooping. A for the arms, numbness or weakness in one arm or the other. S, stability, being able to stand on your feet. And then T, time, getting them to the hospital in time.
The S stands for stability and speech.
Yeah.
Okay.
There's some different abbreviations you can see on different websites, but some of these symptoms: S, stability, speech. And then time, getting them to the hospital in time when you recognize these symptoms. Very important.
I've seen stroke in a few people, and it's just so different when it happens. And sometimes the speech won't just be slurred; it will be, something unrecognizable, gibber. Just something that's not natural. It's not making any sense to anybody. They're words; they're calling words, but they're actually forming the words, but they are not really making any sense.
Yeah. I want to say something about the fat because we say avoid high fat. High fat. I want to be careful about fat because not all fat are bad. There is, those nuts. There is plenty of fat in nuts, and those are healthy fat. Olive oil and those certain type of oil are healthy oil as long as you don't fry with it. Because when you start frying with oil, it changes the nature of that oil. But fat is not always bad. So, and fat can protect you against a heart attack and stroke.
Okay. We've had a few questions to come in from our audience. They basically were asking, what is an average age for stroke, or is there an average age?
Stroke can happen at any age.
Stroke can happen at any age.
Yes, but as we get older, we increase our chance of having a stroke. Okay. You can have a stroke at age 40, at age 50, at age 60, at age 70.
And I knew a little girl in daycare that had a stroke. She was about 5, and she had a stroke.
Yeah, probably she has some type of other issues. But increase the older you get, increase your chances of having a stroke. But you cannot change nothing about your age.
Even on the paper where you change your age, remember it does not really change anything because you are not accepting your truth.
So what I want to say to the listener, don't worry too much about the age. Age is just a number at the end of the day. What you have to do is to change those risk factors that you can modify. That's where your focus needs to be, not on the age.
So even if you're doing all the right things, as you age, you're still unsusceptible to a stroke?
Yes. You can exercise, you can eat healthy, you can do everything
all
right.
The things that you should do.
And die early from a stroke or heart attack.
Okay.
But
that's not helping us, right?
No, but what we're looking at is what are your chances of having a stroke?
Right.
So you have less chances of having a stroke or heart attack if you do the right thing that we said earlier. If you don't do it, you increase. I mean, there is a calculator, by the way. We can tell you what is your risk by putting your blood pressure, by putting if you're a smoker or not. Just by smoking, I mean, increase your risk of having a stroke drastically. Smoking is the one is extremely
And is that
dangerous.
smoking anything?
Smoking.
Smoking. Period.
Smoking, yes.
We call it smoking.
Well, you have to clarify these things.
Yes.
Because, people say, well, I don't smoke cigarettes. But
so-
that doesn't mean you don't
Because the
smoke
only thing that's going
cigars
to your
or
lungs
Which is true.
marijuana or something.
Probably people that smoke marijuana have less chances of having a stroke than smoking cigarette. But doesn't allow you, doesn't make you a smoker, okay?
Okay.
So those are the risks that you can prevent and you can modify to avoid a stroke. But don't worry about your age. Don't worry about your race, because if you're African American, you have more chances than anybody else to have a stroke. But it's okay. We can live a long and very healthy life by doing the right thing.
Okay, so we're not going to worry about age here. And so you can put up whatever you want to on that little piece of paper, even if it's not on your birth
Age
certificate.
is just a number.
It's just a number. Unless it's a man or a woman, right? Oh, excuse me.
No.
I didn't mean to go there.
Yeah.
Okay, and you had another question from our audience. Blood clots. They want to know about blood clots. Is there a certain location in the neck or the brain when you're having a stroke? Or is it anywhere?
Okay. The blood clot, like I said, first of all, the first thing that you might have, it's not totally a blood clot, it's a thrombus. Okay, you have this plaque.
That's the thrombosis? Is that what I was looking at? Or?
Yes,
Right,
it's
okay.
you have already inflammation in your blood vessels. Okay, and the inflammation in your blood vessels can move and block the artery, and you can have it inside your brain, but also you can have it here on your carotid artery. So if you have a stroke, what we do also, we check the blood flow, and if there is also obstruction in your big artery here, which is the carotid artery that go to your brain. Okay, if you have 70% of obstruction, most of the time we recommend that we remove that obstruction, because it's an increased risk of stroke. In any cardiac disease, mostly what we call this atrial fibrillation. Atrial fibrillation is your heart. It's a heartbeat that is totally irregular and irregular, because your heartbeat should be boom boom. If it's
Boom, boom. Boom,
and it should be like music. But if it's no longer music, if it's beating as they want, you can have blood clot that form inside your heart, and those blood clot can move from your heart to your brain. And we have a recent case also where that blood clot traveled from the heart to the kidney.
From the heart to the kidney.
Yes.
And what did that cause?
And gave a heart attack, a heart kidney.
Yeah.
No, there you go, a kidney attack.
Kidney attack. Yeah.
Yes.
So they were on dialysis?
No, because they have two kidneys. You
Yeah.
have two kidneys.
Yeah.
Oh, okay.
The other kidney
All right.
can take over.
Yeah, the other kidney take over. But yes, you can have a blood clot that goes from your heart and go boom, and instead of going up, go down into the kidney. So those are, because when you have those heart condition, you can have those blood clots that travel to the kidney, to the brain.
So blood clots can actually travel anywhere they please and
Yes.
cause trouble.
Yes.
Yes. Yes.
It can travel to your lungs. That's what we call blood clot in your lungs. And you short of breath immediately, and
Okay.
some people die from it.
Wow.
Be careful when you, let's say, when you travel from here to Hawaii without stopping in Denver.
And you don't get up and
Get up,
and walk around. And
walk
you can,
around.
Yeah.
You can have a blood clot and PE, what we call pulmonary embolism.
Yeah, right.
So the blood clot is just not brain attack, is lung attack, kidney attack, heart attack. It's
And then stroke if it's in the brain.
yeah, that's what we call brain attack.
Wow. So we're not trying to frighten our audience. We're just trying to help them realize that these things can occur.
Yes,
And if you have certain risk factors, then you may be at a higher risk
absolutely.
for
Yes,
stroke and
yeah. Remember Serena Williams,
PE,
which
pulmonary
is
embolism.
Serena Williams, which is
had the baby.
more active than anybody,
Than anybody.
sitting
Right.
here. had blood clot in her lungs.
They weren't even taking this.
And I'm just as active, and I had one in my lungs.
Really?
And I remember it's
How
like,
did you? How do you know? How did you
I
know?
didn't know. I just was having problem breathing, as
Yes.
Dr. So said, and I knew to go down 911 to get to the hospital. But when I got there, it was like, okay, you have this here, and we're gonna put you in ICU in 3 days. You know, they want to start this heparin drip and give you this little shave ice.
That's to try to get the
24
blood.
hours.
Yeah.
Bring me my book. You know what I'm talking about? The one.
Bring me my Bible, right?
Thank you. And on the third day, I was back in my room.
Right. Okay.
Yeah.
They couldn't find it, but yes, that's where it traveled to.
Mm.
Yes, and you're right. It can travel, which is
Right.
scary. And I mean, every little breath you breathe,
Yeah.
it's like
You have to
But the
catch your
body
breath.
has a way of compensating for some of the trauma that it faces.
Okay, here the problem is you compensate if it's a chronic problem. If it happened over 3 months, 6 months, your body learn how to compensate. But if it happened at the instant, your body doesn't have time to compensate.
Right.
That's the difference.
Gosh. That's the difference.
Yes.
And that's a big difference too.
Yes, that's
Yes.
that's a big difference, more than a big difference. Like, I'm going to give you an example. If you anemic and you have chronic anemia, so your body you go from 14 hemoglobin to 13 to 12 to 10, 9, 8, 6. Then 6, you start really getting short of breath. You say, what's going on? But because it happened over a long period of time, so your body has time to adapt and to those changes. But if I cut your artery and you go from
You're losing
14
blood.
to
Right.
6 hemoglobin,
Right.
or that's you'll probably be gone.
right.
And it's
As they
people
say, bleed
also,
out.
People that run in altitude, people from Kenya and Ethiopia, they run in those mountains, so they have more hemoglobin than all of us sitting here. And when they go to a marathon, and they just blow everybody out.
I'm one they blow out.
And it doesn't necessarily have to do with steroids.
Yes, because they,
Even
they
wait a minute. Even in the Kentucky Derby, the horse was on steroids.
Yes, the Kentucky Derby is different because those horses can take they take steroid, they can take pain medicine like Percocet that we take. They take it so they don't have the pain when they run. They don't feel the pain. They take anything that you can imagine.
So
So don't worry.
Well,
Don't be surprised that we lost 20 horses in California last time, and I believe there is another field where they lost recently 8 horses. So
Oh, wow.
they losing horses every day. I think we stay beautiful, but there is a problem with those horses.
yeah.
Oh, wow.
Yeah. So even steroids that are used as a medication and a treatment for various diseases can cause problems for us.
Yes,
Side effects, blood clots.
Yeah, but remember now we have better treatment than taking steroid for long term. I'm just going to give you the example of rheumatoid arthritis or lupus. When you have this inflammation in the beginning, you can give steroid to just calm down the inflammation. Then you give other medication, which is what we call disease modifier, that can treat those lupus or rheumatoid arthritis in the long term to avoid those flare up. Okay,
Right.
but the steroid is just given for very short term. Before those medication, we give steroid for long term, and that create weight gain, hypertension,
Right.
Attitude
damage to your
adjustment.
bones. I mean, other
Yeah.
disease. But now it's very different.
So we're going to take a break for the summer, and we'll be back after our summer break. But what are some of the things we need to do over the summer to stay healthy?
Exercise. Eat your vegetables and your nuts. Plenty of berries. Stay hydrated.
Yes, that's it.
And get you a bike and a scooter later, but definitely get you a bike.
Leave my scooter out the picture.
That sums it up, right, Dr.
Yes,
Sal?
absolutely, absolutely. I mean,
Don't
get
be
you-
sedentary this
yes,
summer.
get hydrated. Mostly when it's 90 degrees
Stay
and you're
hydrated.
outside. Stay hydrated. Stay hydrated.
Well, we need to start staying hydrated today because it's so hot outside
Yeah.
now.
Oh,
It's
yeah.
not summer. We still have almost a month.
And we haven't gotten to well,
Yeah.
Right.
well, oh yeah, we're a
And
whole
if
month
you-
away.
And if you're going to be really active outside, like if you just decide you just going to exercise or do whatever outside, try to do it in the earlier part of the
Yes.
day or the later part in the evening, right before the sunset.
Even for the elderly that used to walk and it's too hot, go to the mall.
yeah, you can do it
Definitely go to the
inside.
Go to the
Wow.
mall. Go to the mall at 7 a.m. Nobody's there. You can walk.
And they open it up for
Yes.
you.
It's open because they have to clean. They have to do a lot of
Right.
things.
Wow. That's a little early, but okay. I don't guess it's too early to walk and get
I mean,
your
if you're
day
elderly
started.
and
You
you
feel
retire,
charged and you
Yes.
feel energized. You'll be energized and
Yes.
ready to face the day.
You have your purified water.
Our producer over there, Penny, says she walked 3 hours. 3 hours?
miles.
3 miles. Okay, 3 miles.
I have to look and see who that was, but that's walking 3 hours.
There's a 39-day challenge that some of our Facebook friends are doing from Memorial Day until the 4th of July. Move for an hour, whether it's walking, running, or just moving.
Yeah, absolutely.
Move for an hour. That's a 39-day challenge.
39-day challenge starting
Memorial Day through the 4th of July.
But I started this week, so.
Exercise for an hour, move something,
Just
do
move.
something.
Just move.
I started 39 days ago to that count.
Let's do 39 more.
Okay, I got you.
It's a
That's
lifestyle.
actually a
It's-
daily
Yeah.
daily lifestyle improvement. And so that's what we're going to do this summer. We're going to move it, shake it,
Just move.
just keep it moving. Keep it moving. And eat balanced diets. Eat lots of vegetables. Drink plenty of water.
Right, your body.
And ride your bike. But move. Not just ride your bike, but move. Keep it moving. We want to thank you, Dr. So and Dr. Pettyjohn, for joining us today. Is there a number you can give us from the Morehouse School of Medicine? Because you do provide medical services over there. So is there a number that our audience can call? 404
752
752
1000.
1000.
That's the number
That's
of the clinic.
1000.
744 752 1000. And we open 5 days a week from Mondays
to Friday?
To Friday.
Okay.
Yes.
And you close what time?
Well, we close at 5.
At 5.
From 8 to
8
5.
to 5. Okay.
Yes.
So the early bird gets the worm. Get up and get there. And you're open all summer.
Yes.
And we do same day appointment. That means you can be seen
And you can walk in.
the same day. Yes,
Okay.
that's what we call same day appointment. We don't call it walking anymore. We want to use a nice term. Everybody has an appointment, which is a same day appointment.
Yours may be after everybody else's, but
No. We have doctors that are dedicated to a same day appointment. They sit there. The only thing they do is same day appointment.
Yes.
Yeah, it's not
Let
that.
me put that out there. 'Cause
It's not that we have, we see you at the end of the day. Absolutely not. We'll see you the same day with the same day appointment. And we have a doctor that's all he's doing all day.
Really?
To see you same day
well, that's
appointment.
great.
That's awesome. I'm just going to send everybody there. That is really nice.
Is Dr. Satcher still there?
He's in campus.
He's
Yes,
on
main
campus.
But
Okay.
he's almost retired, but he's still present
Okay.
at Morehouse School of Medicine.
Okay, all right. Dr. Satcher used to be over at the Centers for Disease Control and Prevention.
Yes.
Right, yeah. Well, anyway, we want to
And he
thank
was also past president
past president of Morehouse School
of
of Medicine.
Morehouse School of Medicine.
Ah, okay. So what is his title now? Is he still?
Is Professor Satcher.
Oh, Professor Satcher. Okay. Well, all right. Thank you all for listening. This has been For Your Good on WCEG talkradio.com on the WCEG network. And we'll see you in our next season. Have a good evening.
Thank you.
Thank you.
Thank you.
Night.
Thank you.
Like something.